I thought I would take a moment to talk to you about the long-term impact of firearms-related injuries and potentially some things that people may not be fully aware of. And the things that people may not be aware of is that any retained fragment could have a potential long-term complication. And while rare, it does actually occur. My dissertation included research into firearms-related injuries and war injuries with retained fragments. It's been estimated that over 32,000 Americans were wounded in Iraq since March of 2003. Fragmentation wounds accounted for approximately 49% of the wounds in the Persian Gulf War and 46% of wounds in the first phase of Operation Iraqi Freedom. Most shrapnel will have caused all of its damage at the time of injury. My interest was actually related to retained embedded fragments, and I was specifically interested in the retained embedded fragments of one kind of metal, which is tungsten alloy. Tungsten is a naturally occurring mineral that's found in rock and can be melted or combined with other metals to form an alloy. Because it is strong and flexible, it's used in many everyday items such as light bulb filaments and X-ray tubes, and has been used for a long time. In 1913, Coolidge built the first successful Roentgen ray tube with a hot filament and a tungsten target. Most people in the U.S. population ingest tungsten through food, water, and air, which results in average blood levels of 1 to 6 micrograms per liter. The blood and the urine levels can be used as a biomarker for exposure to tungsten. Although the risk is considered to be minimal, there is some evidence that occupational exposure to dust produced by hard metal industry may result in adverse health effects. However, the general belief is that the adverse effects are related to cobalt and not the tungsten itself. With the exception of LD50 and rats, for the injected tungsten and tungsten compounds and epidemiologic studies of occupational exposure to tungsten, there are few studies identifying the health effects of either oral or dermal exposure to tungsten compounds until the studies of Miller and Kalinich. Kalinich investigated the potential health effects of heavy metal tungsten alloy using a rodent model developed to mimic the shrapnel wounds in soldiers from the Persian Gulf War. The model was originally designed to study the effects of depleted uranium. The dramatic findings suggested a strong link between tungsten alloy and pleomorphic rhabdomyosarcoma that metastasized to the lungs. 100% of the rats implanted with both low and high dose tungsten alloy developed aggressive tumors. The rate and development of rhabdomyosarcoma is far greater than in studies using nickel. The findings of Kalinich raise serious concerns about the health effects of tungsten nickel cobalt alloy in munitions. Now I'm going to tell you just a little bit about the different kinds of weapons and their uses. Weapons can be divided into low, medium, and high velocity, as well as explosive devices. These weapons are used in different types of violence. For example, the improvised explosive device is more commonly used in terrorist incidents, the high-velocity weapon in warfighting, and the low-velocity weapon in street violence. Likewise, different types of weapons generally cause injuries in different locations. Advances in healthcare have resulted in improved survival rates for gunshot victims and combat casualties. The overall survival rate for penetrating injuries, including gunshot and shrapnel wounds, is dependent on many factors, including number of injuries, location, time from injury to treatment, and the Glasgow Coma Scale. The state of Oklahoma, which tracks gun injuries and not just fatalities, reported an incidence of gun injuries of 56 per 100,000 in 1995, with an overall survival rate of 70%, of which 41% were discharged home from the emergency department. Most gunshot victims who die from their wounds do so within the first 7 days, whereas explosion victims die later in their hospitalization. In the civilian population, deaths from firearms are believed to be a good indicator of firearms violence, despite the lack of nationwide data and non-fatal gunshot wounds. The rate of non-fatal gunshot wounds is estimated to be 2.6 times the rate of fatal gunshot wounds, indicating the magnitude of the public health problem. In 2004, there were 10.1 deaths per 100,000 related to firearms. Moreover, approximately 12% of civilian traumatic brain injuries are from violence, including gunshot wounds, whereas in the military, penetrating traumatic brain injuries are approximately 50% of all military-related injuries. The majority come from bullets and fragments. It is estimated that over 32,000 Americans have been wounded in Iraq. Fragmentation wounds accounted for approximately 49% of wounds in the Persian Gulf War and 46% of wounds in the first phase of Operation Iraqi Freedom. While a paucity of literature exists on the percentage of retained fragments from fragmentation wounds, it has been found that 1/3 of patients had retained fragments, which, if predictive of gunshot and shrapnel wounds in general, would indicate that approximately 15% of those wounded will have retained fragments. It is not the general practice to remove retained fragments unless they pose a danger. The number of retained fragments is less likely to occur in the civilian population rather than the military for 2 reasons. First, most civilian injuries are not part of a mass casualty event because such events may require altered standards of care. And 2, most civilian injuries are from low-velocity gunshots and non-explosive devices. The approach to treating patients with retained fragments remains controversial. While some recommend removing fragments whenever possible, others suggest a conservative approach, leaving the fragments in place. The debate over approaches to treatment is largely based on the best immediate outcome for the patient, assuming that there are no or minimal long-term complications of embedded fragments. The most common manifestation of a retained fragment is pain, but more serious complications include neurological symptoms, vascular compression, abscesses, granulomas, infection, lead synovitis, and lead intoxication. So it's a little food for thought to realize that there are metals out there like tungsten alloys or tungsten compounds that can be used in bullets. And in studies using rats, those metals have been shown to be carcinogenic. It isn't an argument for or against certain types of munitions, but it is something for us to think about. The people that say all the lead in the environment on gun ranges and all the tungsten on the gun ranges has no impact are just quite frankly wrong. It does leach into the soil, and it can potentially get into the groundwater in the long run. So it is just one more aspect to consider. It's certainly food for thought. But I suppose the most important aspect to consider is actually the percentage of wounds by weapon type and by population, and to know that low velocity handguns, velocity weapons are handguns, and high velocity weapons like rifles are also the more common ones used in the civilian population. One of the great concerns in our current era is that a lot of those high velocity weapons are now possessed in the civilian population and are causing injuries. As you can see from Table 2, it basically breaks down the percentage of injuries caused by gunshot wounds as opposed to explosions. And you can clearly see that the majority of injuries are to the trunk and to the head, upper extremities and lower extremities being about equal. Obviously, the trunk of the body, center mass of the body, being the main location of injury. Thank you for the consideration.